Hi everyone, today we are going to talk about how we approach to a patient with an epistaxis. First, we need to have a personal preparation since we have lots of patients with COVID-19 nowadays. We need to use personal protective equipments like shields, glasses, protective masks, medical gown, bonnet, etc. But now we will discuss the normal circumstances today. First, we need to take our patient to a quiet room and try to keep him or her calm. Since stresses may cause high blood pressure and this may increase the bleeding. While we are taking the patient's history, we need to squeeze the alley of noise between our fingers like this. Especially we should squeeze the soft part of the noise, do not squeeze the nasal bone. The basic questions we need to ask are you on a medication? Are you using a blood thinner? Did you get any trauma? Have you get any systemic diseases? Did you get any nasal surgical record more recently? Have you get any contagious diseases? If the nose is still bleeding, we need to insert an anterior nasal pack. First of all, we need to prepare our medical tools. Our tools are nasal speculum, nasal bayonet, forceps, medical cotton, and headlights. First, we need to insert our headlight properly. We can adjust its size behind. We need to ensure its fit. When we turn the light button on from the side, the light ring should be exact direction with our gaze. If we are right-handed, we need to take this nasal speculum with our left hand like this. This true, and this is wrong holding. This is true. This is the bayonet forceps. The holding should be like this. The most common errors while the holding bayonet forceps like this, it's wrong, and this is wrong too. We need to hold like a pen. We are taking the cotton, just a little bit cotton part. Insert the cotton like this. First, we need to examine the inside of the nose with speculum. If the cavity is filled with blood, first you should remove the blood clot with an aspirator or ask your patients to blow out his nose or nose. After you detect the bleeding site, you can put your nasal pack slowly, like this. After we insert the cotton tamponade, we can wait 10 to 15 minutes and ask your patient to squeeze her nose while waiting. While waiting, you can check the throat since the bleeding may continue as a leakage from the posterior. After 10 minutes, we are checking the throat with a tongue depressor. When we can be sure about there is no leakage from the posterior, we can take out our cotton tamponade with bayonet forceps, like this, slowly. Then we tell the patient about medical treatment. If the bleeding is continue, you need to consult the patient to an ENT specialist.